Hi, Lynn. How are you? My name is Dr. Gary Alter. My last name says it all. I do groundbreaking, life-changing surgeries. I'll cut away this a little bit, and I should be able to do a great job. It makes me feel good to know that I can help a lot of patients regain their lives or live a normal life because of what I can do to repair their bodies or their genitals.
Hi, Dr. Alter.
Hi, Lisa. Nice to meet you.
Nice to meet you, too.
My name's Alyssa. I'm 19 years old, and I'm going to see Dr. Alter to have pubic liposuction.
Pull up a chair. Okay, Elisa. So let's talk about why you're here.
For the pubic liposuction?
Okay, so now what's the story? You used to be a lot heavier?
Yeah, I used to be like 180 pounds when I was 16. So I'm 19 now. And I worked really hard to lose the weight, and that's the only area I can't seem to like work out and lose the weight in.
Okay.
And I'm just super self-conscious about it. I'm kind of here to see you to get rid of the fat.
She's lost a lot of weight, and this area really hasn't changed at all. So with her, I think the only way to get rid of the fat is to suction it. You have a pretty significant fat pad, which you would know, of course.
Right.
So what I'm gonna do is I'm gonna make an incision, real tiny one here and here, but they're gonna be hidden pretty good, okay? And then I take my liposuction cannulas and I kind of crisscross them, and I'm gonna flatten this down pretty good, because you have a pretty good sized fat pad.
Yeah.
Okay.
He said he will be able to pretty much take away that fat, that extra fat that I have in that area, and make it as smooth as possible. Won't be completely flat, but it'll be so much better than what it is now. So that's what I'm looking for.
It takes about 6 weeks for 80% of the swelling to go away.
Okay.
But you'll notice an improvement right away.
Oh, sweet.
Okay?
All right. I'm really excited seeing that. I've really wanted this done for a long time now, and it's finally gonna happen. So.
Why don't you get dressed?
Okay, cool. Thank you. This is the reason why I would want to wear or have the surgery. Like, so I can wear shorts. You've seen me in these before. And I sit on my hips.
Oh, they're really cute.
And you always ask me, like, oh, why don't you wear a little top with it? When I put them on, it's like I have the bulge, like, right there. And I just feel, like, way uncomfortable.
Around 10 is when I really noticed, like, I was getting pretty heavy. I was probably 130 pounds then. And then in grade school, I just noticed that I wasn't as cute as some of the other girls going to school with, you know, because I was overweight. I think 16 years old, I was at my heaviest. I was about 180 pounds then. I was huge then, wearing about a size 36, I think. And I just looked at myself like, oh my goodness, this is out of control. And so I talked to my mom about it, and we just started dieting.
Is this gonna help with your dating?
Yeah, I believe so, as far as maybe, like, wanting to pursue things. I don't want to get too involved with most of the boys I meet in fear of, like, them ever finding out my secret or something like that, so.
Well, maybe we ought to keep it for a while longer.
No, I don't know. I'm, like, 19 now. I think it's time to move on sometime.
I have met a few great guys that I could have seen potential with, but because I am so embarrassed about my area, I've cut the relationship short. I just believe that this surgery will allow me to take a relationship farther than I have.
So you excited? Almost over.
Yeah.
And then you can eat.
Today is the day of my surgery, and I'm going to be getting pubic liposuction. Right now, I'm a little nervous, but excited that today's the day, and it's finally gonna happen.
Elise, how you doing? You nervous?
A little.
Don't be nervous. This is not a big deal, okay? So let me get you to stand up. I'll make my little purple marks. That's it.
Cool.
Okay, that was the hardest part of the operation. Okay. Alyssa will benefit greatly from the surgery since it'll eliminate that unsightly bulge that makes her so self-conscious.
Hi, Alyssa.
Hi.
I'm Dr. Tahiri, anesthesiologist. How are you today?
Good, how are you?
Good. You ready for the surgery?
Yeah.
Here we go. Take a deep breath. It's all done. Not bad, huh?
Nope, not at all.
Mom, do you have any questions for me?
No, just take good care of her.
I sure will. No problem.
Today's Alyssa's surgery, and I'm a little bit nervous because it's very difficult when your child is going into surgery because anything can happen.
All right, here comes the medicine.
We'll be here the whole time, okay? We'll take great care of you, all right?
You know, I want you to close your eyes, go on a nice vacation spot somewhere on the beach.
So here we see the bulge here of her pubic area, and it's just not flat at all. So what I'm gonna do is just get away or remove this isolated area of fat and make her nice and flatter and make her so that she's no longer self-conscious. What I'm gonna do is make a couple of small incisions and then take some small liposuction cannulas and remove the fat. I'm gonna infuse fluid here because when we do liposuction, we like fluid or a mixture of saline or saline light fluid to be inside the fat. It makes it so that there's less bleeding and it makes it so it's easier to remove the fat. She really has a very obvious fat pad that you can see why she's somewhat self-conscious. Most girls that have this done don't have fat pads this big. A lot of doctors are afraid to liposuction in that area because they think that they may injure the clitoris or one of the sexual organs. But if you're careful and you know the anatomy, that is not gonna happen. I'm always thinking and protecting her clitoris. We're really getting pure fat out of here. So, I mean, there's no question this girl has a lot of just pure fat. Looks pretty flat to me. So we put in about 250 cc's of saline. I removed about 200 cc's of a mixture of fat and saline. And as you can see now, she is very flat. So she's cured.
Alyssa, guess what?
What?
All done.
You did great.
Beautiful.
Keep going. Great.
Awesome, that's great.
Hey, you.
Hey.
Everything went great.
Yeah.
So now you can wear a bathing suit.
I know. That's so good.
You go to the gym and have tight clothes on. Alyssa!
Hi, Dr. Alter.
Oh, you look terrific. You look so cute with your hair and everything.
Today is my post-op with Dr. Alter. It's been 5 days since my surgery, and I'm here to make sure everything's going well.
Well, let's see how you did.
Okay.
Okay, now you have to understand.
It's gonna be quite bruised.
Well, it's not going to be that bad. It's not so terribly
Oh,
bruised.
no, not at all. Wow.
Whoa, yikes. Okay. You can tell that's a lot flatter.
Yeah.
Okay, now it's going to get flatter than that even.
Oh,
All right.
awesome.
Alyssa looks great. She still has some swelling, obviously, since it's only 5 days since surgery. But even with that swelling, she's markedly less bulging in that region than she was preoperatively. Major difference already. It's
Yeah.
absolutely. I mean, you're normal now.
Yeah, no, it's like,
Okay.
I am normal.
Yeah, you're normal. Well, at least down there.
Yeah.
Okay,
Thanks
we don't
so
know
much,
about all the
Dr.
rest. But okay.
It looks great, especially after 5 days. I was totally happy with the results, and I can't wait to see what it looks like in 4 weeks.
I'll see you in about 2 weeks.
Okay, good.
Okay?
Sounds
All
good.
right, bye.
Bye.